Great. We're going to go ahead and get started. I know we've had a lot of people that have requested to see recordings of this webinar. I know a couple people joining live today. So thank you to those of you who are here with us live. We'll make sure we give you the chance to ask any questions about this. And then for folks who are listening to the recording, encourage you to reach out with any questions to us after you listen to the recording. So we're happy today to be sharing more about a learning collaborative that Healthy Schools Campaign is launching called the Medicaid Expansion for School Health Learning Collaborative. And so today's session is going to give an overview of the Learning Collaborative. We'll talk more about the opportunity that is kind of catalyzing the launch of this Learning Collaborative, speak about the application to join the Learning Collaborative, and then be sure to save time for question and answer. And we promise to get you out of here well under an hour today. Next slide. So just a few housekeeping items. As I mentioned, our session today is being recorded. We ask you to keep yourself on mute while the presenters are speaking, but certainly encourage you to come off mute during Q&A at the end. And then also the chat function is enabled today. Don't hesitate to throw questions into the chat or any comments throughout the presentations. And we've also dropped a link to today's slides into the chat box if you would like to download those. Next slide. So today we'll introduce you to the team at Healthy Schools Campaign that is leading this work, and then we'll take a little bit of time to give an overview of what the opportunity is that is leading to the launch of the Learning Collaborative. We'll do an overview of the Learning Collaborative and the application to participate, and then save time for questions and answers at the end. So this is the team at Healthy Schools Campaign that is supporting today's session and will be supporting this Learning Collaborative. I'm Alex Mays. I'm the Senior National Program Director with Healthy Schools Campaign. I'm joined by Laura DeStigter, who's the Project Director for the Learning Collaborative, which we're calling MESH for short. And then Stephanie Palmisano, our Senior Administrative Manager, is on as well today and will be supporting the work of the Learning Collaborative too. So just to ground us in the opportunity that is leading to the launch of this Learning Collaborative, we're really excited to be embarking on this work. And at its core, we really want to be providing school districts in Illinois with the opportunity for peer-to-peer learning around a chance to expand school district Medicaid programs in Illinois. For a long time, Medicaid has paid for school health services delivered by school districts in Illinois, but historically that's been limited to services that are written into students' individualized education programs. And so that's more of your special education services, your speech therapy, occupational therapy, physical therapy, along those lines of services. But in 2014, the Centers for Medicare and Medicaid Services made a policy change that gives states the opportunity to expand their school Medicaid programs and allow school districts to bill for any Medicaid eligible service delivered to any Medicaid enrolled student, which really creates a tremendous opportunity to expand school district Medicaid programs and draw down additional federal Medicaid revenue to support this work. And so while that policy change happened in 2014, states have to make the decision to move forward with this opportunity and allow school districts to bill for this expanded scope of services. And so it, again, creates a really important opportunity, but districts need to make that decision to move forward with the change. Next slide. And so there has been quite a bit of progress that's been made since this policy change happened in 2014. The states in dark green are those that have moved forward with expanding their school Medicaid program through this opportunity. So districts in the dark green states, districts in the dark green states can bill for all medically necessary services delivered to all Medicaid enrolled kids. And so in those states, Medicaid reimbursement is no longer tied specifically to those services in students' individualized education programs. And then the states in light green are those that are in process of expanding. And you'll see that Illinois is in process, which I'll talk in a moment about what that looks like and what that means for Illinois. Next slide. And so just a little bit about where Healthy Schools Campaign comes into this work and why we want to be doing this in Illinois and supporting school districts in leveraging this opportunity. All of Healthy Schools Campaign's work sits at the intersection of health and education. We work on a whole range of issues from school food to environmental health to school facilities, school playgrounds. But core to our work over the last 20 years has been supporting expanded access to school health services. And so we worked with many other national groups to actually advocate for the federal policy change that happened in 2014 that allows states to expand their school Medicaid programs. And then after that policy change happened, we launched in partnership with the US Department of Education and Health and Human Services a national learning collaborative, which now has 15 states participating in it to support states and school districts in expanding Medicaid funded school health services. And so through that work over the last really 6 years, we've been providing technical assistance and resources on expanding school Medicaid programs to states and school districts across the country. And so through that, we've really just come to see this as a tremendous opportunity for supporting increased access to and resources for school health services. And we've also really come to see just the tremendous value of providing opportunities for peer-to-peer learning around implementing this policy change, which is really what has led us to launching this new learning collaborative in Illinois. In Illinois, Healthy Schools Campaign is based in Chicago. We have a long history of working on all school health issues within Illinois, and around this issue specifically, really since the 2014 policy change happened, we have been engaging with the Illinois Department of Healthcare and Family Services, with the Illinois State Board of Education, with other decision makers, most recently Governor Pritzker and his staff around this opportunity, and really encouraging the state to take advantage of it as a key mechanism for supporting expanded access to school health services. We also work with a number of key school health stakeholder organizations and key partners across the state to really support this work. So by no means are we doing this alone. It's very much in partnership with a lot of key groups that are leading this charge as well. And we feel honored to be partnering with them on this work. Next slide. So where things are in Illinois, as you saw on the map, they're light green. So they're in the process of moving forward with this change. In April, the Illinois Department of Healthcare and Family Services, which is the state Medicaid agency, issued a public announcement that they will be expanding the state school Medicaid program. And they're now in the process of developing what's called a state plan amendment. And that is something that is needed to implement this change in Illinois. They submit a formal change request, the state plan amendment, to the Centers for Medicare and Medicaid Services for review. That will ultimately get approved and allow Illinois to change their state Medicaid plan to implement this change. It doesn't require legislation. It's just essentially a regulatory change. And these state plan amendments happen a lot, but it is the step that needs to happen to implement this in Illinois. And what that state plan amendment will do is allow school districts to bill for all medically necessary services delivered to Medicaid enrolled students in school districts in Illinois. So really just expanding the scope of what districts are able to bill for, no longer limiting it to services that are just included in students' individualized education programs. The state plan amendment is also going to recognize additional school health providers as Medicaid eligible. We're still waiting on the specifics of what that exactly will look like and which school health providers, but essentially what it will be is making a move towards recognizing the qualified school health providers who are delivering services within schools as Medicaid eligible, and really doing a better job of recognizing who we know is qualified within the schools doing this really important work and delivering those services so that districts can get reimbursed for their time. And then the state plan amendment is also going to make a modification to the state's reimbursement methodology around the school Medicaid program and change it to something called a cost settlement reimbursement methodology. Next slide. So before we go into more detail about the Learning Collaborative, I think just to say, we really feel that the potential impact of this change and the opportunity it presents for school districts in Illinois is tremendous and really exciting. We see it as a chance to increase sustainable revenue for school health services within the state. In the states that have expanded that we work with, they've seen a significant increase in federal revenue coming in through Medicaid to the school districts to support increased access to school health services. And so our hope is obviously that that increase, ultimate increase would be reinvested to expand access to health services and providers in schools, which would ultimately mean being able to serve more kids in schools in Illinois. And we know, as the data shows, that improved access to school health services can reduce overall healthcare costs, improve academic outcomes, just really support the positive outcomes that we really want to see for kids in the state. So we're excited about this. It's a lot of work cut out, for school districts, but a tremendous opportunity. And that is really what is leading us to want to create this peer-to-peer learning network for districts across the state to give them the chance to learn from one another and really support implementation. So with that, I will hand it over to Laura, who will share more about the Learning Collaborative and the application process.
Thanks so much, Alex. Thanks for giving us that helpful context and background. And I will dive into some more details of what we'll actually be doing as part of the Learning Collaborative. So our objectives for the Learning Collaborative are for you to be able to develop a comprehensive plan for securing Medicaid reimbursement and expanding school health services, identify and implement effective strategies to bill Medicaid for eligible school health services, and leverage partnerships and funding from Medicaid and other sources as well to expand health services for students. Healthy Schools campaign uses an early adopter strategy to build capacity and foster innovation in districts that are really ready to be leaders in this change. The experience of our participating districts as they work to accomplish the project objectives is going to help light the way for other districts in the state. You would be the first of 3 cohorts over the next 4 years, and we'll work with participants to identify best practices and lessons learned that can be disseminated to other districts and also used to improve state policies, systems, and programs. We're using a learning collaborative model for this project. Learning collaboratives were initially developed by the Institute for Healthcare Improvement to help healthcare organizations implement quality improvement projects. And since then, this model has been adapted for other types of settings as well. And there are several core elements of this model that we'll be using. The first and probably most important is peer learning. So we will be here along with our partners and advisor to provide you with supports and resources and take you through a structured process. But you all will be generating strategies and solutions that you share with one another. The second is a team approach, which I'll talk about a little bit more on our next slide. Third is really an emphasis on improving systems. So in this case, we're looking at your billing and your health services infrastructure. Finally, learning collaboratives combine group educational sessions and individualized support with teams developing and testing new strategies between those educational interactions. So each participating district will form a team to participate in the collaborative, and your team should include staff from the areas of school health services, behavioral health and/or wellness, special education, finance and/or your billing vendor, and district administration. Aside from the administrator, who should be at the district level, the other team members can be school level staff. You will need to identify these members in order to submit your application for the project. And if for some reason you can't identify someone in one of these roles, just go ahead and reach out to us and we can talk with you about finding an appropriate substitute. We also recommend that you include other partners on your team, such as a parent or student partner, representatives from other agencies that are providing health services in your school, any other staff that you think are important to include on your team. For those folks, you certainly can identify them before submitting your application, and there will be a space for you to include them, but you can also think through those partners and identify them after you are accepted into the project. And we've designed this team structure because we feel that this group of required staff is really going to bring a nice complementary set of knowledge and skills to help you be successful with this work. Districts will participate in the collaborative for 2 years, and we're going to follow a process that's outlined on this slide. So you'll start with engaging your stakeholders and building buy-in around this work. You'll conduct a needs assessment and asset mapping to look at your capacity and look at your needs so you can develop a strategy for billing, data collection, communications, service delivery, all of those pieces. Then you will create an action plan. Your initial work is really going to focus around building capacity for that expanded billing. And once that's in place, then you'll look at expanding services. You'll implement the plan, you'll monitor it and evaluate how it's working so that you can make needed changes. And then we'll ask for you to submit a progress report at the end of each school year. Again, it's a phased approach, so we'll start by using this process to really figure out the billing processes, capturing billing for existing services. And then in the next phase, you'll look at how you can develop a strategy and a plan for expanding those services. To help guide you through this pathway, the Mesh Learning Collaborative will provide 4 trainings per year. The first 3 will be 2 to 3 hours approximately, and they'll be held virtually. And then in May, we hope to be able to convene for a longer, probably 5-hour in-person meeting, if that's safe to do at that time. We will also have 4 group calls over the course of the year to facilitate peer sharing and provide additional guidance. And we've tried to stagger these so you have either one or the other each month. And we would like all team members to attend both the trainings and the calls to the extent that that's possible. We'll provide a monthly newsletter during the school year, and we are setting up a website with links to resources and tools. In addition, if districts are identifying a common need for a resource or a tool that does not exist, we will work on creating that for you. So if you need some sort of template for parent consent or something like that, that's something we can pull together. Finally, we'll also be offering individualized assistance with questions and challenges, including the ability for us to communicate your feedback back to HFS and the Illinois State Board of Education. The value of the training and the technical support is valued at about $20,000 per district, which is fully covered by scholarships from Healthy Schools Campaign's philanthropic contributors. And districts will need to cover just staff time, any travel to the in-person meeting, and any other costs that they have associated with implementing their plan. We plan to provide a mix of capacity building or skills types training. So that would be focused on things like increasing buy-in and support from key stakeholders, developing a plan for implementing changes, coordinating and communicating with stakeholders. And then we will also have opportunities to work together on specific challenges, which could include things like securing parent consent, documenting medical necessity, or coordinating with your community providers. We are convening an advisory group to support this collaborative, and these organizations will be helping with developing our project offerings. Many of them will be presenting on trainings and group calls, and they'll also help answer questions from our participants. And we feel very grateful that we're able to benefit from all of their knowledge and expertise. In order to apply to the project, you must be an Illinois public school district, have approval from your district leadership, and have the staff members of your district identified. And you should also be ready to actively leverage the training and support provided by the collaborative to expand your school health services. We do ask districts to commit to participating for 2 years, and we expect all the team members to consistently attend trainings, group calls, and other events. Teams will need to develop and implement an action plan, complete an annual progress report, meet together on a regular basis, and respond to our communications in a timely way. We anticipate that you will spend 3 to 5 hours per month participating in project activities, and that would include preparing for and participating in trainings and calls, meeting with your team, developing your action plan, those types of activities. Your participation will hopefully facilitate what you are doing as part of your routine job activities. And we also hope that we will save you some time by providing resources and technical assistance to help with challenges that you are facing in doing that, and giving you some strategies and a process for expanding your Medicaid billing and health services. So I am going to pull up the application so we can take a look at that. And I believe Stephanie is dropping a link to the SurveyMonkey in the chat. Okay, so what I'm showing is a PDF of the SurveyMonkey. We're not directly in SurveyMonkey. When you do go to the SurveyMonkey link, we suggest that you try to complete this in one sitting, just because depending on your computer settings, there's no real guarantee that it will save if you close out and come back. You could also just leave the tab open on your computer over a period of time and work on it in a couple of sittings if you'd like to do that. On our call for applications page, which we'll share the link for again at the end of the presentation, there is this PDF copy of the application so you can take a look through the questions before you get started in SurveyMonkey. Okay, so in the first section here, I'm just gonna walk through and just make sure everyone is clear on what we're asking for and why. So we start with asking for some demographic information about your district. And we are hoping to have some diversity in our collaborative, as well as hopefully having a partner for each district that is similar in size and other demographics, so that you have another district that is somewhat like you as you're working through different strategies and solutions. The next section asks for you to list your team members and to describe why they were selected and the role they will play. So we have spots for those specific team members that we would like you to include. And then optionally, if you have identified other team members, you can list them there. And then we're just looking for you to share some of the knowledge and experience and perspective that you think each team member will be bringing to this work. The next section is interest and capacity. So we ask why you would like to participate, and what we'd like to see there is your vision for how this is going to benefit your student. So really thinking beyond just the billing or Medicaid piece to what impact, broader impact this is going to have on student health and well-being. We ask about challenges that you are currently facing or expect to face. And that's just so we can help think through what types of support you might need during the collaborative to help with our planning. And then we ask about how your team, sorry, I think I got ahead of myself, how your team will contribute to the learning collaborative. We just like to get a sense of what you will bring to our peer community, and then any other opportunities or partnerships that exist within your district that could help support this work. And then in our last section, we ask about your training needs. Again, this is just to help us with our planning. There'll be a pretty short turnaround between when we accept districts and when we move into our first training. So this just helps us make sure that we are planning to meet your needs. We don't expect you to provide lengthy answers for any of these. Some could definitely be answered in a few sentences. I can't see really going beyond a couple of paragraphs for anything. If something makes sense just to list out kind of in bullet points, that's okay. We don't want this application to be really onerous for you. We just want to get a sense of, your perspective and make sure that you've thought through how this project is going to meet your needs and make sure that you have the capacity to take advantage of what we're offering. So then the final thing here is just to sign off that you have read the certification and participation requirements. All right, I'm going to flip back over to our slides. And you can see the image here. This is what it will look like when you're actually in the SurveyMonkey. All right, well, we will go ahead and wrap up. And I believe Stephanie is going to drop the, sorry, I forgot. I still have a few next steps. So reminders, applications are due September 3rd at 6 p.m. We will get our notification of acceptance out by September 24th, and we will have our first training, if you can hold days during the week of October 25th, or it may be early that following week. We are going to send out a doodle poll with the acceptance to try to find a date for our first training that will work, hopefully for most people's schedules, and we will record that as well. So we're going to drop the link to the call for applications in the chat again, and we will have the recording of the webinar posted on that page. So if there are any other school districts or colleagues that you would like to share this with, you can go ahead and send that out. And feel free to send me an email with any follow-up questions that you have. We really appreciate you joining us today, and we're really excited to launch this exciting project.